All right, Doctor, we're live.
Hey guys, it's Dr. Emer. We are doing some brow threads right now. I'm going to show you really quickly what these are. We're doing brow and face threads. We have a gorgeous client here, but she wants to be preventative. So we're using on her brow area NovaThreads. These are PDOs. You could see up close, there's actually little spikes on them. They go under the skin like this in a port that we go right into the skin. And then we pull and it lifts the brow, okay? And there's numbing here. You see, look, it's lifting the brow. So pull there. Hold on. I have you hold right here while I tie this one. I'm gonna tie this one so you guys can see what it can do. So this is gonna be preventative for eyelid sagging, for the brow sagging. You see, look. These go under the skin, they hook into the skin, and they build collagen over time. And so these are going to give her a lift that she'll see now, but honestly, she's gonna see more of it in the next probably 6 months. You can see here. There we go. You can see the elevation now in the brow. Just gonna hold. Sometimes you get a little vein. You just have to hold it. Turn a little this way. I'm gonna show you guys this side. Hold there. And then what we're gonna do, we're gonna go on this side. We're gonna do InstaLift. So I'm gonna lay her back. Get a chair. So you guys let me that chair behind. I'll get this. Perfect. You got that. Grab your chair. So now we're going to start the InstaLift portion. While we get the little band to stop. But you can see the elevation now. The cool thing is this is not going to move, literally. It's going to be super tight. It's going to lift. We have 6 threads on each side that are holding. And then we're going to go all through here and literally tighten everything. So I'm going to do, so you guys can see, turn this way again.
So Dustin, again, how long are these results going to last her?
We just said, you guys.
It's going to last forever, guys.
No, these are 6 to 12 months.
6 to 12?
I wish they were forever. I wish they were. This is going to build collagen over 6 to 12 months. This is something she would do once or twice in a year. I'm going to have you just hold here a little bit. We're going to leave that thread for a second. Hold here. Just hold right here. Move this way. There you go. So pressure. We let it sit for 5 minutes. Okay. So now what we're going to do, we're going to take a little alcohol. We're going to keep the area really clean. And now we're going to focus on her midface.
You guys, this is our patient that we've been following. We did plasma PET to her as well. You can see her eyelids look much nicer.
Yeah, her skin basically is perfect.
We did CO2. We've done several laser treatments as well.
Yeah, okay. Go ahead. Okay. So now we're going to use InstaLift. These are bi-directional threads. You have the tip. And she really shouldn't feel much with these. You can see I directed them directly where I want her to get lifting and collagen. Jump, and collagen production. I'm gonna move that because I need to go. Yeah. And the collagen production will occur over the next 2 years. So she really is going to make out with this treatment because it's going to give her 2 years worth of tightening and collagen. And what I'm doing is I'm doing it in a very specific way that I call is the spider web kind of lifting, meaning we're like scaffolding the whole area so everything gets tight here. It's not just specifically one area, we're lifting everything. You guys see what we do. Her skin is actually really tight, which is amazing.
So, Dr. Emer, what about using energy devices for lifting? How is that compared to threads?
No, they don't really lift. They tighten skin. Lifting is different than tightening. We already done Morpheus on her. That's why she looks so snatched. So this is good. The Morpheus will contract the tissue and build collagen in that way. But the threads are going to lift the tissue and anchor it and pull it. So it's a combination of things. It's like saying, I'm going to go work out, but I don't need to take a supplement. You want to do both. You want to do the supplements and the working out, right? Alright. You can see, look at that. We're pulling. We're tightening.
Hi, Dr. Emer. If you have oily skin and do a procedure to minimize pore size, will the results last?
Well, it's a good question. Everything you do for your skin needs maintenance. So, how do you feel, by the way? Is there a lot of pain?
Nope, no pain.
Unbelievable.
So that
Just can't
answers the
talk.
people asking
Yeah,
if she's asleep.
I'm sorry. No, wide awake. I just can't. I'm numb, so I can't talk.
She's numb, can't talk, and anyways, I don't want her to talk now, even though I love her, and don't want her to talk. Well, I'm doing this because I want to make sure that these go in perfectly. Obviously, when someone's doing strings on your face, you want to make sure they don't all of a sudden move to the wrong area, and then you're lopsided. Not what we want, right? So we want to InstaLift and make it even. You see, we're making sure the threads are going in perfectly. Excellent. Now everyone, the thing about bidirectional threads is you get these little indentations. You're gonna always have those when you do this, but it tightens the skin much more. So those will calm down over the next few weeks.
So, Dr. Emer, does the procedure leave marks behind?
No.
Where the areas the cannula has
But-
been inserted?
No, but the little indents will be there for a week or two, but if they're there, they tighten everything. If they're not there, you don't get as much tightening because you're not anchoring the skin. We need the skin to anchor. Okay, and that's what we're doing. You guys see the ends here? See these cones?
We had a ton of people join us. They're asking if she's awake right now. If she's awake,
Smile.
look at those
Show
cones.
them your beautiful smile.
Hi.
If you can. Show them that beautiful face. You guys, she's awake. She's healthy. She's happy.
We're doing good.
Okay, so now we're putting in the cones. You see the threads. Beautiful. And it's lifting, it's pulling. I call this the mega lift. This is Dr. Emer's mega lift because we're doing brow, mid-face, lower face, and neck. Beautiful. This is going to treat the jowl area and literally just give her the most snatched jawline. Look at this, she did face tight 2 weeks ago, I think. And look already how tight this jawline is. Some people call it the high def jaw. I just call it face tight because we're tightening the face. And now what we're doing with the face tight is going to build collagen over the next sort of year, really. And it's going to be only enhanced by what I'm doing with this. I'll just get your earring off. So I'm going to put that. Hold on, here, Jay, take this. Yeah, okay, we'll get it. So you guys see, I'm making sure threads are exactly where I want them to be. Good. Give me that. Can you give me that? No. Okay. Take it right now. Look at that, you guys. See?
We're at 8.
The degree of tightening. Look at this.
Look at that tightness, guys. This
Okay.
other show comparison to the other side
Okay, one more.
over here,
Lower
which does
jaw.
no threads right now.
And right now, turn a little bit this way. We're gonna get lower edge of the jaw. Again, mega lift. Going all the way down.
We've already done her eyebrows.
Has it stopped? No, stop. And so what are they asking? Because this is, I know, a very
We
a
have-
procedure that everyone seems to ask me about. They get really scared for my clients because they've never seen anything like this before.
We have over 900 people watching us. We're
Wow.
amazed by this. We have a lot of reactions out of this. They're asking, is she alive?
Oh
Is
my
she
gosh, you
awake?
guys, this doesn't hurt at all. Like, literally at all. I'm like relaxing. My eyes are closed because I'm like, I'm so relaxed.
She's getting in her zen place right now. So the neck's a little bit treated a little bit differently. We're still doing the threads, but it's placed a little bit differently because
A lot of people ask you, what is this that I've just joined on? If
tell
you
me
talk about our
more
Mega
about it.
Lift, this is Dr. Emer's Mega Lift right now. We're using PDO and InstaLift threads. We already did over there by her brows, and we're coming down here down the side of her face,
okay.
and we're coming through her jawline. Previously, she did do face type. We did Morpheus 8 as well, and some other laser treatments to make her skin look beautiful.
So now I'm enhancing it by putting in my threads. And the threads will dissolve over a few months. There we go. Look at that, you guys. Look at that snatched jaw. Look at that.
Wow.
I don't think it could be any tighter. The tighter the better. Alright, we're going to do one more on the cricoid. We're going to get it to be even more tight. This is my spider web technique, is what I call it. One more down the lower part. And then half the face will be done. You guys can see, look.
Let me see again.
Show you. We'll do the whole thing in a second.
Let's go.
For all the areas. Okay, so last of the jawline now. So we're surfing the thread directly under the skin. Watch out. Perfect. And then this is going to corset the neck and produce more tightening. More collagen, more tightening.
This is, our patient is definitely numbed before this. She
Oh, yeah,
does
you
not
can't-
feel a lot of
We
pain.
don't torture people here. Okay, so I would never do this unless someone really requested. Okay, hold on. This area is very tight from the previous treatment, so I need that needle back. Perfect. So we got to work the thread. Done. We need the forceps. Yeah.
All right, someone asking, what does Dr. Emer's Mega Lift cost?
I don't know.
I don't
Yes.
either.
So, Doc, if you need a consult for this, you can get us at emeragecosmetics.com. You can book an in-person or virtual consultation with us, or send us a DM with your full name, email, and phone number, and we will reach out to you.
Give me the scissor. We'll do another one.
There you
Good. It's actually hooked on, so we're fine. It's actually placed. Mm-hmm. It's secured. Okay. Look at that angle. See? You guys see this angle that we created? So that's perfect. See? There's the angle that's created right here, the edge of the jaw. So that side's done to completion. I'm going to leave the threads in there. We're going to turn to the other side. Rotate. Yep, now I'm
So
gonna
one
show
said,
you
I
guys-
love this treatment. I've never seen anything like it before on Instagram.
I've left actually one of my threads here in the brow, so you guys can see these are different. These are PDO threads, and you can see if you look really up close, all these little spikes. Can you see them or no? The little
Zoom in and
spikes.
see.
Yeah, you
Well,
can
you
see
can
those
see the
very
spike.
clearly. So those spikes are gonna hook like a rosebud, like a rose petal, or what is it? Thorn onto the skin. Thank you. And then that's going to give collagen production. So this is going to lift the brow. You see it? Good. Okay, perfect. So like even if I grab this with the gauze, look what happens. The gauze pulls, you see? Hold on, I want to irritate her too much. Yeah, we just did. That's okay. We got it. Okay. I'm going to grab. Perfect. That on the side. Great. That will stop in a second. So now we're going to finish on this side. So that's really it, you guys. That is the InstaLift. Now what I'll show you really quickly one more, then I'll let you guys go unless you want to keep watching.
We're still over 1,000.
Let me move this. Go over here. And my things in my hand. Perfect. So now we're going to, again, follow our path, follow our vector. It's very important that you do your vectors properly. Otherwise, the person's face does not look how it should after the lift. And then what we're going to do, and you see where.
Do you guys accept care credit or are you seeing new patients?
We always do, yes. And so you guys see, skin's really tight from the lasers. There we go. Perfect. So I'm going to show you guys what you need to do. What you need to do is activate the cones. So we press, we activate the cones. That's what we're going to do at the end, what I'm going to show you guys here. That's why this little dimple forms. But by activating the cones, you now anchor it into a new position. And that allows us to get the lifting, which is going to be what's going to make her look snatched and tight and very happy. So these are my go-to facial threads. Now all the PDO threads that are being done, they just don't last that long. What are they saying there, Jordan? Beautiful. Look at that. So we're placing those in. Perfect. I'm sure they're saying something, no? Or are they just
I have a lot of comments in Spanish.
Oh.
So it said, why didn't you put her to sleep?
Why does she need to be good at sleep?
It doesn't hurt.
She's happy.
Oh, I'm smiling. I can't move my face.
She has nerve blocks, you guys, and we wouldn't be giving extra medication if not needed. There's no point.
That answers the many questions
in giving
about pain and being knocked out.
Yeah,
That's a lot of people are asking.
You don't need to.
Guys, this is the Mega Lift for those of you just tuning in right now.
This is Silhouette InstaLift, what I call the Mega Lift, because we're doing all areas, multiple threads. And it's all based on measurements. We measured her face, designed the vector.
Can you see something really quick?
Yeah, of course.
I just want to say that.
Turn a little bit to the right. The right, not left. There you go. Yeah, there you go.
We'll blame the numbness. So I didn't choose to do this treatment. I walk in, I trust this doctor so much that I say, look at my face, and whatever you think.
And give me a suggestion,
No, not even. I just do it. That's why I made the comment of I don't know how much. I just trust him so much.
This is why I think this type of relationship is very important, because you want to go to somebody who is going to have your best interest. You don't want somebody to do a treatment on you if you don't think they need it. I just know I know what she wants for her long run, and I know how happy she'll be. And so.
And if he says, let's do it, I 100% say, okay.
Let's do it. And this is something we'll do once every year to 2 years, maybe a year and a half.
So like I said, OMG, what is this?
I
Can we
don't
show
know.
how the threads work? The spikes, the thorns on the end?
Well, these don't have thorns. These are cones. And you can't see that right now. Unfortunately, you will in a second when I do the other thread. This is InstaLift. So remember, InstaLift has cones. PDOs have the thorns. Hold on. I'm trying to get her skin's really tight. So every so often you're going to get one little spot that may have difficulty going in. Like this one.
Is her face going to be really swollen after this?
Not much, actually. Just a little, but really not that much. There we go. Okay.
Guys, you are watching the Mega Lift right now. We are using different types of threads. We did the eyebrows, we're doing the cheek, and we did the jawline as well to make her even more snatched than we did before with FaceTime and Morpheus 8.
And I'm awake and I'm happy and it doesn't hurt.
She's happy, it doesn't hurt, and you guys, I know you're always so worried for my clients, which is really sweet, actually, but I have my best interests out for them, so it's okay. Everything's gonna be fine. So we're snaking under the skin. I'll show you how these threads work.
How is scarring going to look?
No scarring. So you can see, I'll show you on this thread. Here are the cones. They're secured on there. Screenshot. And they are going to secure under the skin. So we're placing them in the areas that we want true tightening, shaping. There we go. Look at that. Contouring. So I'm pulling it high and tight on the edge of the jawline, the 90-degree angle. Okay. All the way through here, and we're pulling it up at the angle of the mandible. And that's our goal, is just lift. And I will tell you, if this isn't done well or right, what do you think happens? You can't root them. So you gotta wait till they dissolve. So you better do it right the first time. Which is what we're doing right now. Okay, and these I like to pull a little bit further back to the auricular fascia, all the way back here, so that we can get a nice degree of angle at the jawline. Good. Thank you. Okay, and then move over just a little. Turn all the way through. Now we also did some filler to her necklines. That's filling in. Go ahead and down there. Go ahead and grab that. Turn a little less for me. There you go. And see, we are going to the neck area on these angles that I'm doing this special type makes it a little bit harder to do, but again, we want it high and tight. We want it to be sculpted and defined, and so we're doing what we gotta do. There we go. Amazing. Look at that, you guys.
Can she feel it?
Look at that jawline.
Maybe sometimes a tiny bit of pressure, like forehead, I didn't feel it at all. That, a little bit of pressure.
Come pan over here. Show them at the top. Take a look.
Let me come over there. We'll show them the
them
thread.
that angle. See, you guys, look at this is the jawline we just created. Look, it's pulling all the way high and tight, all the way across, right at the angle of the jaw, right where we want it to tighten. Look at that. Perfect. One more to go. Looks absolutely beautiful.
Guys, she will not have any scarring, any marks after this. The dimpling will go away. And we will show you her final results from this. We'll show you what the Dr. Mega Lift does.
And you really won't see it fully for a few months, but you can start it now. We're cross-hatching. We're doing my spider web technique. specialized technique here to get that real angled look. There we go. That's okay. Take this a second. There we go. Good. Secures are fine. This feels so tight already. It's even harder to get this in.
If you did watch some of our previous lives, you're a frequent viewer of us, you will see that we did do face tight for our patient. We did other laser treatments as well.
It's okay. Just do one more. It's okay. She can do a little extra thread. No big deal.
Bonus thread.
Can I talk?
Yes.
I cannot wait till you can post the before and afters. I had no jawline and full end double chin.
I don't know about that completely. Is true.
I have proof. I'll show you the photos.
Okay, to see and hear more about it. I know you do have photos. You have your own and Jordan's that was there. There we go. Go ahead and take that. So this area, like I said, the tighter it is, the harder it is to get it in, which is good that she had, she already had the face tight. That's why it's already a little tighter to begin with. Perfect. Great. Again, here you go. Let's see that level of tightening there. Take a little grab. Alright, so now the best part, we're going to finish here with the tightening portion. The actual securing. Go ahead and go there. Clean up the alcohol, please. The alcohol. See everything there. Good. Perfect. Alright. Now we're going to clean. So this is the most important part, keeping everything clean. So now we're going to clean her off to make sure that there's no blood, that all the threads are clean before we secure. So I'm going to show you guys really quickly one side. Take a look. So again, what we need to do is in each area we need to secure the cones. We need to secure the cones. Okay. Activate the threads. Activate your threads. That's what we're doing right now. Activating threads. So right here. Okay. And again, same thing here. We're going to activate the cones. There we go. Look at that level of tightening. We're going to activate all these cones. They're underneath. Look at that. How tight that holds. Good. Put it right on her. Edge of her. Turn backwards a little bit. Same thing here. Activate these. Perfect. So now we're going to remove, we're going to close some of these threads. They're all secure, so we're getting rid of them. We're hiding them under the skin. We want her to get a tightening. And double check, make sure all the threads are cut. Let's see the last thread here. And we get all the threads in this section. Let's see there.
At what age should we do this?
You know, it all depends on how preventative you want to be. Go ahead and turn left now. This side.
I'm 40 if that helps.
Yeah, we're like the exact same. So we're doing, I think 30s to 40s is good for preventative. We're activating the threads. Tightening. She's gonna look amazing. So the point is just enhance what she has. Try and make it any better if you can. You know? See how we're activating all these, pulling tight. Perfect. Good. Those are great. Threads are secure. And these are nice because they hide. You can't tell anyone had anything done. When you do this, when it's done well, they're hidden under the skin. You can't see them, you know? And now, if you look, hold on. You can see, look how tight that jawline is. So look at the top. You guys can see. So again, clean her up a little bit. Now we red light. But look at that jawline. Let me show her. Go grab the mirror for her. Small mirror. And we did her neckline full of filler. And we secure. What I want her to see, go ahead and hold this. Take a look at the neck.
Oh, yes. Oh my gosh, it's so awesome.
I don't think
I'm
it's
still so
possible
numb,
to be
so the
tighter.
excitement's not coming all the way through.
And you look really good for having multiple spots. So these will go down. This is going to be secured and tighter. Look how much tighter it is already on the jaw.
Oh my gosh.
Right now there'll be like a little bit of bunching. That will go
Yeah.
down. And then that's it, you guys. We just let it heal. You let it
I
work.
have a double chin and I have a jawline.
No double chin, snatched jaw. She's happy.
Oh my gosh,
Everything's
yay.
great. That's the mega lift with brow on Saturday clinic, you guys. So have a good weekend, and we will see you soon. Anything else you want to tell them? You did great.
No, just Dr. Emer's the best. That's all.
What a wonderful ending to this section.
All right, guys.
Bye,
We'll see you
guys.
later.
So now what I'm going to do, I'm going to lady up.